Take the best and leave the rest, right? Take the best, leave the rest. Um, I'm happy to provide consulting services to all of you. You all have a way to reach me and ask questions. I always answer you, and if I didn't answer, send me another email because I will get back with a response. It's important for us to disseminate safety information, so that's why I encourage you to contact me, even if you're not my client. I really enjoy your questions and it makes me grow. So you push me, you help me, you challenge me. I love that. So do it, do it. My learning objectives for today: describe work surface, at least 3. I want you to take back to work at least some of the most problematic work surfaces at your places of employment. I wanted to mention at least 2 of the most important updates that you have to make to your current COVID-19 policies and procedures using that new document. Oh my gosh, awesome information. I just did a training this morning at 7 a.m. 30 minutes in English, 30 minutes in Spanish, and we discussed the training topics that are included in this employer playbook. So it's important to make that update. So I just gave you right there, and then one of those important updates you need to include in training during your training sessions about COVID prevention. You need to include a couple of notes there for employees to know what you're doing in regards to if there's a positive case at work. That's happening to many of us, where now we're seeing employees coming to work and saying, or calling us, I tested positive for COVID-19. Now what? What do we do? This employer playbook has guidance in this regard. So I love it. Understand OSHA's view regarding the requirement to logs and also the reporting requirement. We did hold a full 1-hour webinar regarding recording and reporting for OSHA. This is just going to be a quick review because the employer playbook, and every time I say employer playbook, I'm referring to this document released by the California Department of Public Health on July 24th. So that's what this session is all about, bringing up updates and the new stuff that the California Department is coming out with, and helping you to just keep an eye out on how to keep your policies updated. Remember that there was a lawsuit. So the Amazon case in one of their warehouses, the suit was brought by an employee. She's an order picker at the warehouse. By the way, this is all public information. It got to me through the OSHA News Reporter. If you are a subscriber, you get all of this info. She alleged that Amazon failed to take adequate measures to protect warehouse workers, including, and listen to this, and this is why I put it in my slides, because it gives you an idea as to where the perception is at. Perception is reality, you guys. So we are dealing with human beings at our places of employment. We all perceive this issue of COVID-19 prevention a little different. As safety coordinators, you deal with this wide range of cultural backgrounds, age, generational issues, etc. So you must do like a blanket cover and really accommodate for everyone to have a perception that you are doing safety the best you can, because this new document, the actual employer playbook released July 24th, will or may be used against you if you fail to protect workers. And this is one example. Failing to sanitize common areas and equipment. So right there, you should be thinking, are we not sanitizing common areas and equipment? I'll tell you one thing. As I renew my field inspections, which, some of them will be done in person and some of them will be virtually with you, my client. But as we renew these inspections, one of the things that I see is if you have break rooms where you allow people to use coffee makers and you're allowing them to use, how do you call these, to warm up your food, microwaves, all of the things that have buttons where people are touching, that's what this means too, failing to sanitize common areas and equipment. So not just the equipment they work with, but think about those coffee makers, those microwaves, and any other surfaces that they touch. Provide them with wipes so that as they finish making their coffee or serving their coffee or warming up their soup, that they can sanitize, and put signs so that people get reminders. Some companies go as far as to, well, in healthcare, just an example, a clear example, as you sit there in the waiting room and then they call you in, they go right behind you. You get up and they sanitize your chair, the handles of your chair, the back of the rest of the chair. So there's a designated person to sanitize common areas. So you don't rely on that sign and the good faith of the employee to sanitize those common areas, right? But do it. And during training, tell them, don't rely that the coworker before you cleaned it up and disinfected. You take that wipe and you wipe those surfaces that you're going to be using, especially with break rooms, etc. There are some industry guidelines, by the way, that prohibit now the use of certain common areas and having, for example, coffee machines in break rooms. The barber shops and the hair salons, for example, in their checklist, the industry checklist, they specifically say those are not allowed. Why? Because it just, in certain settings, it just increases that chance for people to gather around and talk and not observe that 6-foot distancing rule, etc. Look at this second bullet point: failing to sanitize freezer suits used by multiple Amazon employees while working in freezers. So when you have shared, some of you have refrigerators or walking cold storage areas, and you provide jackets for workers. They will see that as you not keeping up with COVID-19 prevention procedures. Why? Because now you're allowing people to share the same jacket, and they're grabbing it and then walking in, leaving it outside, and then another worker comes and grabs that jacket and uses it. So things that were commonly used before or shared is not acceptable anymore. Not acceptable at all. Failing to ensure proper physical distancing between employees. This is an interesting issue. We all know this. We have been increasing awareness about the physical distancing issue throughout this many months, and yet we fail to keep it up. It's easy to forget, especially if you have to share a document, if you have to share critical information, or if you're an essential worker, right? Why? Because there is that lack of what is it? I want to say it's no lack of awareness. We're very aware of it. It's just the fact that we're working and we have that need to share information. So through training and repeating these things, and by the way, more and more we are actually telling each other. Before, it used to be rude to say, hey, keep your distance. Now we don't. It's like, remember to keep your distance, and we continue to remind workers, or we say, hey, I'm going to walk faster than you to keep that distance. So little reminders like that will work, because the perception that the employee has in regards to how you are observing these policies and procedures will play a very important role, right? So we have now more information about the virus, but mind you, even Mr. Robert Redford, the head of the Centers for Disease Control, has said, you know what? I don't have the answer to all of your questions, because this virus was introduced to me 6 months ago. So there's a lot to know about the virus. One of the things that we do know that is nasty about this virus is the fact that asymptomatic people walk around and can spread the virus, right? So this is something that you need to discuss with your workers, because the face covering issue continues to be controversial, continues to be very political. Let's stop making it a political issue and make it a public health issue, and remind them of this during work breaks, safety meetings, and say, you know what, I understand all of the issues around face coverings and people not wanting to wear them and stuff like that. For right now, I ask you to put that aside, and as an internal policy for this place of employment, if you want to be working for us, we require that you wear a face covering at all times. So in regards to face coverings and universal masking, there is a study that was done, and I want to share it with you because you may want to share this during training. And it was put out by the Centers of Disease Control in conjunction with the, let me see, why am I not able to see it? The National Health Institutes, right? And I love it. Look how they tested, let's see, 3 faces, and then there's the results. Are you seeing my JAMA network Safari? Yeah, internet, not my slides, but you're seeing the internet? Yeah, perfect. So the results, they tested nearly 10,000 healthcare workers, okay? And then they tell you the faces and everything. You can read the whole study, but remember this: during the pre-intervention period, the SARS-CoV-2 positivity rate increased exponentially from 0% to 21%. So as you keep reading, it says during the intervention. What's the intervention period? That means now that they required face coverings. So pre-intervention period, positivity rate exponentially from 0 to 21%. During intervention period, meaning now with masks on, guess what? The positivity rate decreased linearly from 14.65 to 11.46%. So what does that mean? And then you can read the discussion, but it basically means face coverings work. The data is there, they work. So what happens if at your place of employment you have people walking in without face coverings? You don't allow that, because more and more we are having this strong enforcement of face coverings everywhere we go, at least here in California, because we're considered a red zone, right? We're one of those states where our numbers have not decreased consistently. We have this up and down, and then now flu season is around the corner, and some of our counties are experiencing just higher numbers. And so we need to enforce face covering as an issue at work. We need to train people. We need to tell them of the importance of face coverings. And we also need to add, so I said to do after today's webinar, workplace violence has been an issue lately because of this face covering issue. What do you mean, Alba Vazquez? I mean exactly what you've seen in the news. People are upset when you ask, or they get upset when you ask that they put on their face coverings, right? And it's normal because they feel this is a free country. You shouldn't be able to tell me what to do. So we are not saying we tell people what to do. What we're saying is we have a internal work policy or place of employment policy. And remember, when it's a policy, it's a rule. And everybody who wants service from us needs to observe it. And anyone that works for us needs to observe it. So take a look at your environment, especially you moved into a new building. Do you have enough signs so that people, before they cross that door, before they get into your premises, they are covering their face and their nose? That's super important. And during training today, I explained to them why the face covering is so important, because some people say, face coverings don't stop me from getting COVID-19. And that is true. Face coverings protect other people. So if you're going to ask other people to protect your health, you must protect the health of others. Face coverings are an issue of source control. They prevent those infectious droplets from coming out, landing on surfaces, or in the mouth, noses, and eyes of those people that you come in contact with. So this study is important to show some of the data that some people are asking in case you need it. And I love the interactions here. City of Glendale, California reported to be issuing fines up to $2,000 to $400 for the first violation for not wearing a face mask in public. So it's going to get costly. I love your interaction. So make sure in the workplace you have this face coverage. You know what's happening in real life practicality? People get to your workplace and you already put in place, screening procedures. You're taking temperatures, and they're signing a roster that they get there without any symptoms, that they check their temperature is under 100.4 degrees, and that they have a mask on. And a lot of your employees remember about the mask the moment they are taking their temperature and signing that roster, or looking at the symptoms, whatever they do. But that's already after they cross that door and they're inside your premises. You cannot allow that. And if you see this continue to happen, you must discipline. You must discipline. So make sure you do this, and look at your current city if there's any fines, and also mention this during training so that people know that this is that universal masking is something that is required of us right now as good citizens, and that it is really a public health issue. And so that should be included in your training as a reinforcement and emphasis on masking. Let me now share or go back to my slides where I was at. So super important, that one. And I didn't want to not mention it. What else? So this is basically what I said. When to use the actual face covering. It's a list on the guidance. There's a guidance by California when to use the mask, working in a space. So all of these you can read in your own time, but it's basically at all times, right? Even if you are within that, even if you're not within that 6 foot space of this disease, at all times, wear your face covering. At all times, you're protecting others, and if others wear it, they're protecting you. So lead by example. Hand washing. So The director of the Centers for Disease Control added that not just the face coverings, but the hand washing and the social distancing are the simplest ways to get a handle on this pandemic. Guys, the pandemic is not going to go away in a month or two. Historically, we were discussing that we are seeing pandemics around every 100 years. The last one lasted 3 years. Hopefully, with all the advances, the technology, and everything that we have now available to us, it won't last as long as 3 years. But obviously, with flu season around the corner, this is not going to go away tomorrow. So during our training, emphasizing the importance of the 3 things that the director of CDC is continuing to talk to us about, make us aware of: hand washing, face coverings, and the social distancing, right? With the hand washing and the social distancing comes also the cleaning of surfaces, right? But for the hand washing, what I'm seeing out there in the field is people are not provided with soap. If you have porta potties, they're in horrific condition. They're a little better, by the way, because COVID-19 has brought about more consciousness about this issue. So the porta potties are in better condition, but sometimes they lack soap. There's no paper towels. So during training, tell your employees to report these issues. This is the practical side of things. Tell me if there's not soap. And for those of you that don't have locations like field construction sites and stuff like that, but you just have your clinic, outpatient clinic, or you just have your warehouse workers, whatever you have an auditing system where you go around checking that all your bathrooms have soap, paper towels. Have a schedule to check and audit your restrooms, because hand washing is super important. I tell my workers, if for some reason your porta potties, the hand washing station at the porta potties do not have soap, wash at least with water. Washing with water helps. If you do it vigorously, it does help get rid of some germs. It's not as effective as soap, but it is helpful. If you're going to be using hand sanitizer, guys, now during training also talk about the FDA warning about the hand sanitizers that contain methanol, right? Because methanol is causing blindness, if it's ingested, is actually killing people. And the FDA put out a list of hand sanitizers that you cannot provide or have out there at the work site. So let me share that with you. It's in your slides as well. But there's a whole list of sanitizers. And if you are in the purchasing department, or you're the person that purchases the hand sanitizer, you're ordering it, it's good that you look at this link, because it allows you to search for it. So it's great information about the dangers of drinking hand sanitizer under any conditions. Some of your workers use hand sanitizer, and I see them, they go, and they put the sanitizer and they rub it all over, and then while their hands are still wet, they touch other surfaces such as handles, doorknobs, etc. That's unacceptable. Unacceptable. We need to train them as to how to apply hand sanitizer. Take a look at this FDA list, and you can actually search the product you're providing. And mostly any hand sanitizer from Mexico, although the chemical is not listed in the list of ingredients, may have methanol, so do not purchase any of this. There's a lot of brands here listed: Bloomin', Clara and Danver. There's some with aloe vera and that seem to be natural, whatever. Lots of hand sanitizer listed. Look at this, 94 entries. So make sure that you take a look at this information as well. There were 4 brands that were added this morning that were being sold at Walmart and Target. Oh my God. So, it's the worst thing that at a pandemic, instead of dying from the pandemic, the virus, you die from hand sanitizer methanol ingestion. That's just crazy stuff. So make sure that we keep an eye out on this. If you're the one purchasing, making sure that you keep an eye out on this list is also crucial. Thank you for that information about the brands that were added. Surfaces to worry about. Remember, there was a study being done by the National Institutes for Health. There you have the link as well. The scientists found that this virus can be detected in aerosols. We talked about the fact that we have not classified this virus as airborne. It is droplet, so droplet precautions apply. But we do have that, gray area where we know that when people speak, cough, or sneeze, there's a short period of time where those droplets and particles are still aerosolized. And that's why the social distancing is so crucial, because during that period of time, you are asking people to, keep that distancing, because there are particles that can stay in the air for a short period of time. That's a characteristic of droplets, right? That they actually settle down. They don't stay suspended in air because of the size of the particle, and they don't travel like measles or any other virus. But in this case, you still have that space and time where these particles can stay suspended in air, land in your respiratory tract, and depending on the size of the particle, you know that is how far they will travel into your respiratory system. So make sure, that's why the 6-foot distancing is so important. Through training, we talk to them about the surfaces that we worry about, understanding transmission, and the first way you're going to get COVID-19 is person to person. That's why the face covering and the 6-foot rule is so important. But the second way you're going to get COVID-19, which is not as prevalent as the first mode of transmission, is by touching surfaces and then touching your mouth, your nose, or your eyes. And when this happens, you need to understand that that's the reason why we clean and disinfect prior to starting your shift. At the end of your shift, any tools that are shared need to be disinfected. Any equipment that is shared needs to be disinfected. As we go about this pandemic, we try to stay away from sharing anything. But if you must, because of the type of equipment, very specialized or whatever, it must be sanitized between each use, right? So remember, there's a difference as to how long the virus stays active and ready to infect a person, 2 to 3 days under conditions in this experiment. And detectable in aerosols up to 3 hours, right? But these conditions really vary depending on humidity, temperature, ventilation, and the amount of virus deposited in that droplet on that surface. So guys, how much virus is likely to cause infection is something that remains to be studied. It's stuff that we're learning about the virus as we go along. Thank you for, if your camera is moving around a lot, I get distracted, so I ask you not to do that if you can, please. The findings about these issues emphasize the importance of hand washing and disinfecting frequently touched surfaces. So what are your frequently touched surfaces? You really have to come up with that answer. It could be the cell phone, it could be your work equipment, doorknobs, door handles, handrails, keyboards, mouse, all of this, right? Any surfaces pertaining to the work you do, the tops, there are some areas that go unsanitized because we forget about them, like the back, the rest of a chair, this part of your chair where your back rests. Sometimes people stand up and they rest their hands on them. That's an area to be sanitized, especially if you're still using equipment like in break rooms or areas where you gather to have meetings, etc., keeping that 6-foot distancing. Where to get current information? You do have a link to the data tracker to find out what's happening, what are the red zone states, etc. And then we get into that awesome document that I want to discuss with you. This document is super important because it provides guidance with what to do if an employee is having symptoms. The importance of communicating and coordinating with your local health department. Guess what? Now, in this document, we are told about the fact that you must communicate with the local health department where your business is at, where your clinic is at, but you're also going to have that communication with the local health department where that employee resides. 2 local health departments that are involved. The place where the employee lives or resides at, and the place where your business is at, right? Because they need to guide you. And some of these local health departments will ask you for a roster of the employees and their job positions and some information. They're very good at keeping confidentiality, but this document provides a guide in this regard. Understanding reporting requirements for Cal OSHA. There's also a brief section about that. So for those of you that were not on board with me for a full hour as to when to record it and keep records for OSHA, this is a good guide. But basically, if it happened at work, if the person was feeling ill at work, then you need to keep an eye out, because if you determine, if this person goes to the hospital from COVID-19 and they started feeling sick at work, then you need to watch out for how long this inpatient hospitalization is going to be for, because whenever it goes beyond 24 hours, that becomes a reportable issue under Cal OSHA rules. That means you have to pick up the phone and call Cal OSHA and say, we have a person who fell ill at our workplace and now is hospitalized, has been admitted as an inpatient hospitalization for 18 hours, they expect to keep him for the whole week. That's a reportable to Cal OSHA. So there's more on that, but I basically gave you a synopsis there. Testing and contact tracing in the workplace. See, before we didn't have anything about that. There was no guidance. There was no information about that. You called your health department. They told you, don't worry about it. We will do the tracing, the contact tracing, because we're the ones that have all that, the resources, the people that are supposed to be doing the interviews and the contact tracing. Well, now this document states that you as an employer may be asked to do some contact tracing for the local health department, depending on your operation. So some big warehousing and chains, big chains, are being asked to have a contact tracing program developed to aid the health department. So as a to-do today, contact your local health department and find out what is expected of you in regards to contact tracing. Who's going to be doing the interviews? Are you going to be doing your interviews? Are you going to be doing all of this contact tracing to aid in this process? So working in conjunction with health department is also mentioned in this document. What a close contact is. We know what a close contact is being within that ratio of 6 foot distancing, closer than that for more than 15 minutes, right? Confidentiality of workers, that you cannot under any condition reveal what's the health status of the worker, even if someone says, oh really, I've been exposed, so who is it, or was it confirmed? You cannot say anything. There's even, the CDC even provides you with a template as to what you should be writing, what type of email you should be writing to inform your employees that they have been potentially exposed to someone who is positive case for COVID-19. So if I have time, I'll show you, but this guide has all of that information. It even has a sample email, I believe. Cleaning and disinfecting workspaces, they go into that too. When is it appropriate? Oh, this is huge. When is it appropriate to return to work? So they divide employees into 4 categories, you know, asymptomatic with positive test, symptomatic with positive test, asymptomatic with negative test, and there's another one, and it gets, I have it written down, hold on. Reevaluating the workplace plan to prevent further outbreaks. And I talked about this in regards to incident investigation. That's something we do all across the board. Anytime we investigate an incident, being COVID-19 or, you know, a bad cut in the arm or the hand, whatever, any type of incident in the workplace needs to be investigated with a sole goal of preventing it from ever happening again. So one of the important issues in this new guide is having a workplace infection coordinator. So now I'm going to tell you something that is not in the guide. This is something that I learned as I am renewing my authorizations. I was saying, if you were not in the beginning of the call, I was telling everyone that I am taking my renewal for authorization as a federal and Cal OSHA authorized outreach trainer. And I learned a lot. We've been taking classes online. It's been available to us. So, and that's the reason why I've had to cancel some of the Friday webinars. So I apologize, but I'm just grateful to UCSD for providing these classes and making them available to us. One of the things that we were discussing during this training is the infection control plans and procedures. We already know in California there's an aerosol transmissible disease standard, and it applies to certain employers such as healthcare, EMT or emergency responders, homeless shelters, and we have other criteria to actually find out whether or not it applies to you. And then it goes into referring employer versus full standard employer. If you took the 4-hour class with us, we've done it twice, and we will schedule it again because there's a huge need in regards to this. But that's only for those places of employment. What about the rest of us? Well, this new guide says you have to have a workplace infection coordinator, which is actually a requirement under the aerosol transmissible disease standard, right? That's a requirement. So now they're making it a requirement for the rest of us. Now, so you know, during the discussion we were having in my classes through UCSD, we were talking about Cal OSHA maybe coming up in the future with a requirement for an infection control plan to be required for all places of employment. And I think this is very possible. Why? Because across the board, we are in contact. with viruses and bacteria, right? So infection control is important not just for the healthcare setting. With this pandemic, we're seeing the importance of implementing something like this for all places of employment. So take a moment to really review your COVID-19 response plan, and instead of just calling it a COVID-19 response plan, calling it an infection control plan, so that in the future it stays as your infection control plan to prevent exposure to any of these outbreaks, right? And apply it to anything that is in your area, because this is here to stay. And I believe also this type of program, another program that will be required to keep, right? It's still part of your injury and illness prevention program anyways, because you have to provide with a safe place of employment. But most likely you're going to have to upkeep it and leave it as part of your programs in your facilities. So have a workplace infection coordinator. That means a name, you guys. They want a name, the name of a person that is in charge. Yes, I will send you the link for this guide. It's actually in my next slide, okay? So don't worry about it. And then I love this. I've been making my own sanitizer, rubbing alcohol, aloe vera gel, very easy. Good job. I love it. So yes, rubbing alcohol is wonderful. It's wonderful to disinfect and sanitize. So, but you know, then we get into the hazard communication portion of how to protect employees when we use chemicals. So if it's on an industrial basis, whatever you're using at your facilities, that's considered exposure at work. So remember, I come from the OSHA viewpoint, and I always want to bring awareness as to what the regulations say. So anything you're bringing to the workplace, you have to ask the question, is it raising an issue of exposure to workers? So I could buy something like a hand sanitizer, put it in my purse, but if I'm letting everybody else have access to it by putting it right there, now I brought it out of my purse and put it right there on my desk. Now that brings the issue of exposure to everyone else. Watch for those issues, guys. Those are the things that are happening out there. Be aware of how two different health departments may be playing an important role in how to handle a positive COVID-19 case at work. So I told you guys that it's the local health department for the address where your business is at, and the local health department of the employee place of residence. They both have to be notified of this person who just tested positive. Number three, guidance on testing and interviews. So there's some guidance. I'm going to show you that in the document, how to communicate with workers when there is a positive case in writing, because then you can prove how you told this employee that they might have been exposed. Otherwise, if you only say it verbally, you know, words we're in California, and we need to document all of our safety efforts. This is one of those. Provide information on testing sites. So this 1 through 4 is now provided in this document. Why is it important? Because if we don't follow this guide, if then we end up in court just like Amazon, we have no way of proving that we're actually following the recommended guidelines. And although these are not laws, they're guides or guidelines, this is the employer playbook, this can be back to bite you in the butt if you don't follow through, because everybody's following. So why aren't you following? So do it in writing, provide information on testing sites, meaning tell the employee, these are the places where you can go and get a test. Quarantining if indicated, right? Why if indicated? Because sometimes people may be exposed to a positive case of COVID-19, but he or she is an essential worker, and you need them as part of what you do in your facility. You cannot go without this very specialized area of expertise, or whatever they're doing is so important that you cannot let them go and quarantine themselves. So as long as you have certain measures in place to protect the other workers, you may be able to continue letting that worker stay and work, although they've been exposed, instead of sending them to quarantine. But that's why you work in conjunction with your health department. So it's on a case-by-case basis, really. And watching for symptoms. From where to where, it gives you the actual window. It says from 48 hours prior to them being exposed to this person, and then 14 days, right? Because you want to make sure that they know that, I'm sorry, I'm confusing this. When a person tests positive and they're at work, you are going to ask about who were they in contact with, even 48 hours prior to them feeling the onset of symptoms, because they could have already been contagious during the asymptomatic phase, right? for 48 hours. Then from the moment they started feeling sick on how many more people did they have contact with. All of that becomes part of your incident investigation. And I think I have a question there. Isn't the infection control plan already required under the IIPP? Well, it depends. So the IIPP says that you must make a list of all the hazards that you are exposing your workers to. So for healthcare and some of the places of employment where infection control is a given, yes, it was required. But a lot of the places of employment did not have an infection control plan at all because they never had issues where they never had for example, an on-site nurse or first aid CPR people in their sites. So they didn't have an infection control. And now they're faced to this issue where I have to have one. So start developing them. Remember the Danger and Illness Prevention Program requires you to make a list of all the possible hazards that the employee is or may be facing, and now that's one of them. Maintaining confidentiality, never provide information on health status. So this is great. Here's your link, you guys. The next thing that is important in this new guide, criteria for returning to work, including symptomatic and asymptomatic, positive, symptomatic and asymptomatic negative, asymptomatic untested employees. That's the category that I missed. Asymptomatic untested employees. And it's in page 13 of this guide. So I'm going to take you there because that one is important that we analyze as part of today's 1-hour webinar. 6, reporting and recording for Cal OSHA, which I gave you kind of like a overview summary. Benefits while staying at home. Oh, this guide does make emphasis on employers providing information about sick leave and Families First Coronavirus Act. Why? Because they want you to encourage people to go home if they have symptoms. They don't want anybody at work when they have symptoms because they have uncertainty as to what are their benefits, their pay benefits, right? So this guide requires that that's misnomer. This guide doesn't require. This guide emphasizes for employers to provide information regarding the benefits so that employees with symptoms do not feel obligated to stay working, but that they know and they have reassurance that there is actual benefits for them when they stay at home. An enforcement unit, so it's not just Cal OSHA, but there's a whole list of other regulatory bodies that will be enforcing these rules, right? So let's take you there. So released on July 24, COVID-19 employer playbook for a safe reopening. It goes through an actual, there is the table of contents, the purpose, how to open safely, what to do if there's a case of COVID-19 in the workplace. And this you must study because there's wonderful information here. Managing the outbreak and returning to work. Outbreak identification, preparedness, communication of identified cases, preventing further spread, returning to work, employers cleaning guide, regulation and guidance on reporting and providing sick leave, recording cases of COVID-19, reporting to Cal OSHA, the Family Rights Act, paid sick leave and state disability insurance, workers' compensation, enforcement and compliance, worker education. I love this section of worker education because it gives you an idea of how to formulate your training sessions, right? So basically it's transmission. You have to talk about modes of transmission, the 2 ways this virus is transmitted. You have to talk about how to protect themselves at work and at home. So before we were not really talking about how to protect yourself at home. We talked a lot about at work and what we do at work. And with this guide, you are reminded that because the virus can be brought from home to work, that you must discuss how to protect yourself at home as well. And so it's important because then you bring up issues such as, hey, don't do the barbecue and the quinceañera party because that's going to bring about a lot of people to your house or to a place where they're having a gathering, and then all of them come down with COVID-19. So we're trying to, through training, bring awareness so that it's not just at work, but that it extends also to what they do at home. And some appendix and some examples on what some employers are doing. Packaged food company, local public health role, supermarket chain. It's great. So let me go to page 13, so I take you to that page that I promised. Hold on, because I have to move the, oh, did I stop sharing? Yeah, trying to share my screen here. Here it is. Here we go. So everybody's seeing this return to work, and I love it because the links are very good. So if a worker is symptomatic positive, workers with symptoms who are laboratory confirmed to have COVID-19. So he's symptomatic, calls you, I tested positive. So then this is what has changed, you guys. At least one day, 24 hours. Remember, it was 3 days. Now they changed it to 1 day. This is on the CDC site, and it's also on this guide. At least 1 day, 24 hours has passed since last fever, the finest resolution of fever without the use of fever-reducing medications, and improvement of symptoms. It used to say improvement of respiratory symptoms. So they took respiratory away, and now they say any symptoms, improvement of symptoms. And at least 10 days have passed since symptoms first appear. And do you see this here on your screen for workers cases who not require hospitalization? And then it goes for worker cases who required hospitalization. Is different criteria. And that's important because remember, a lot of the people that require hospitalization many times are immunocompromised people. And so that 10 days have passed since symptoms first appear changes to 20. So to discontinue transmission-based precautions. So great information here. What about if the worker is asymptomatic, so no symptoms, but they have a positive test? So now you have a worker who's spreading the virus, right, without having any symptoms. A minimum of 10 days have passed since the date of their first positive COVID-19 test because they don't have any symptoms. So now you're going to wait 10 days after the first positive COVID test. If they develop symptoms, then the criteria for laboratory confirmed cases applies, of course. Now they're symptomatic, but the test says they're negative. So use the same criteria for return to work as laboratory confirmed cases. That makes sense as well. What about if they're asymptomatic, no symptoms, and the test is also negative? Guess what? They could develop symptoms. That's why it says workers should quarantine at home for 14 days after the last known close contact with the case patient. So this is whenever you send them home and say, you know, you might have been exposed to someone who has been confirmed for COVID-19. We want you to quarantine for 14 days. And then they go and have a test and the test is negative. So they have no symptoms and the test is negative. Still, you say, you know, quarantine for 14 days after the last known close contact with the case patient because symptoms can develop even after testing negative within 14 days after exposure. The local health department may consider allowing earlier return. And this is critical, you guys. This is why you shouldn't take lightly the fact of having the local health department information at your fingertips. They're very good at helping you make decisions. They may allow an early return to work if the worker is in a critical infrastructure industry in which the essential operations of this workplace would be compromised if this worker doesn't come back. There's an actual caveat to that, and I'll take you there. The last criteria, or no, the last, what do you call it? Type of employee, symptomatic and untested. So they have symptoms, you know, they have any of the symptoms. By the way, review the list of symptoms with your workers because we forget, right? Remember, even some of the gastrointestinal symptoms count. The vomit and the diarrhea, that could be a COVID-19 symptom. Runny nose, congestion. So they're symptomatic, but they haven't had a test. Workers who had symptoms of COVID-19 but were not testing, recommended testing, highly recommended. Give them the information, give them the address. If the worker for some reason cannot be tested, use the same criteria for return to work as laboratory confirmed cases. So this is a great table. I love that they provided us with this now. Asymptomatic untested workers who had close contact to a laboratory confirmed case, patient at work, home, or in the community and no symptoms should be quarantined at least for 14 days after the last known close contact with the case. Testing is highly recommended. If testing hasn't occurred, the health department may consider allowing the worker who had close contact to a confirmed case to continue to work if he's a critical infrastructure worker, right? Or if workers refuse, this could happen, a worker that is refusing to go take a test. But he's been in contact with a laboratory confirmed case despite recommendation for testing from the local health department or healthcare provider and has had no symptoms. Workers who develop symptoms of COVID-19 while in quarantine should contact their healthcare provider, even if they're not tested. The same criteria for return to work should be used as if they had a laboratory confirmed case, right? And this is the caveat whenever you see that asterisk regarding the following two groups of workers in a critical infrastructure workplace outbreak: A, asymptomatic workers who tested negative, and workers who were close contacts to confirmed cases. Where the quarantine would compromise operations at work, the local health department may determine that they can return to work sooner than 14 days by considering certain criteria. Number one, the worker is able to wear a surgical mask throughout the workday, except while eating, and comply with all infection prevention procedures. Because remember, the CDC has issued some exceptions to the face covering, and that has to do with whether or not it impedes communication, right? Whether or not the person has difficulty breathing with this type of masking, whether or not their healthcare provider has said that they're not to be wearing this, and maybe they are able to, they can't wear the mask because they have certain issues with it, but you can provide them with the face shield that has the elastic that covers all the way to the chin. And so if they can do this and comply with all infection prevention procedures, so you are okay to return them earlier than the 14-day mark. A cloth face covering may also be used in the event of mask shortage. Facility has implemented all best practice infection prevention procedures. And when it says this, we're talking about walk through your facility and find out where are your loopholes, like signage. Do you have enough signage everywhere? And sometimes, you know, your owners, especially with those nice buildings, they don't want all that signage out there. Well, guess what? During this COVID-19, we are rooting for signage because it's a reminder to workers. When you have a front desk person that is not really vigilant of people coming in and not wearing a face mask, you know, call her his attention, say, you're the front desk person, you are my gatekeeper here, you cannot allow anyone to pass through that door without a face mask. Pre-screening to assess worker temperature and symptoms prior to, if you haven't implemented this, you're late, you're out of compliance. And when I say out of compliance, not because this is the law, it's because OSHA is saying that these guides are being used as part of what they recommend, so they could cite you on this. Workers able to self-monitor for temperature and symptoms at home and at work. Workers able to maintain a minimum of 6 feet of distance. So you have to, if you really have to bring them back before that 14-day mark, you must make sure that they stay away from other workers, basically, right? To prevent transmission of the virus. And you can also provide physical barriers between fixed work locations to supplement distancing, cleaning and disinfection of all areas, shared equipment routinely in the workplaces. So awesome, awesome, awesome. Goes into the cleaning guide. Great, great information. Let me get back to my PowerPoint because we're about to finish here. I think I highlighted the most important things in this guide. And the 9 key changes, I promised you 3 and I'm giving you 9 key changes or updates to your COVID-19 prevention program. First and foremost, review that playbook to see what applies to you. If you're not in California, go to the CDC changes because there's a lot of changes in regards to when to discontinue isolation or quarantine of those workers that might have been a close contact to someone that tested positive for COVID-19. The changes have to do with, remember, instead of 72 hours, 24 hours, and instead of 10 days, 20 days, if it's a healthcare-based type of decision for transmission precautions and immunocompromised people. Review training to include how your place of employment is handling communication with employees when there is a positive case at work. During training, you are going to tell them that there's going to be an incident investigation. You're going to tell them that you're working in conjunction with your health department and that they will receive a call from the health department, maybe not just one health department, but 2 health departments, not to be surprised at this, that they need to cooperate with both. And this happens when they reside in a different county than the county that your business is located at. Review signage in place at work. We talked about those common surfaces that are problematic, coffee stations, microwaves, doorknobs, door handles, and cell phones that are left anywhere and everywhere where other people can come in contact with. Review workplace violence policies to enforce the use of masks. This is something that you want to update your program, because a lot of us are not having this talk about workplace violence because the use of masks, I don't know why, but it continues to be controversial. It's a public health issue. Let's stay away from politics. Let's just start teaching workers how to deal with violent visitors, how to deal with potential conflict arising out of this issue of universal masking. So allow your workers to know under no circumstance are they to get closer to a visitor or a client to tell them, hey, you need to put on a mask, and provide them with a mask. That's not the way to do things. Continue to enforce the 6-foot distancing rule and asking people to wear the mask or to take it if you have like a dispenser of masks. And if someone starts raising their voice or being involved or just getting violent, for your employee to report it immediately to a supervisor, or to have a system so that someone else comes to their aid and they're not alone dealing with a violent person, right? So that's very important. When I said not alone, it means that they have support through phone, through a panic button, whatever it is, but your workplace violence policy needs to be reviewed. Review cleaning and disinfection procedures. A lot of our workers are cleaning and disinfecting without the use of gloves. So that's an instance where disposable gloves need to be provided. Review job positions that are critical in order to make, this is something that you need to make on your end. This is a task for you. Review the job positions that you have that are critical. So in case some of those people come down with COVID-19 or they need to be quarantined, that you make good decisions in regards to whether or not you need to bring them back before that 14-day mark. Include a process to report to your local health department and Cal OSHA, and have incident investigation forms updated. So I updated my form, but you can continue to create and change yours. I'm gonna still change mine. Okay, wait a minute, I can't see it because I'm trying to show you it and now we can't. Okay, here it is. So some of you saw this. It's the Cal OSHA form, guys, for incident investigation. I just changed it to COVID, but this is what I added just last night. Names of contacts, any and all contacts, include how many minutes of or hours were you in contact with this person. Include contacts 2 days prior to the onset of symptoms. Include information about your shift, where you took your break, etc. So this is stuff that you can include there, and I need to give more space in that area, right? So you can request this form from me, and I'll send it to you as soon as I finish it. But this is a changing document, and you can change it as you go along. So if I provide you a copy of this, what you need to do is make sure that you read it and see if it applies to you, or change it, right? In regards to change it to jive with this July 24th document that we just reviewed today. In your opinion, how did you get exposed to COVID-19? And look at this one. Have you attended any of the following within the last 2 weeks? Circle those that apply. Mass gatherings, funerals, social gatherings. Sometimes you go, oh my gosh, yes, I went to a funeral. Or, oh my gosh, we had this small family reunion. And what you're asking here is people to be honest, to give you the information, because this is a pandemic. This is not something that you're going to be punishing them for. This is something that you want the information because you're working in conjunction with the local health department. And remember, the key to stop this is not just the 3 things that we talked about, which is social distancing, the masking issue, and the hand washing, but also contact tracing. And this information will help in that regard. Let's get back to that. And last but not least, as we finish, what you should be reinforcing, the face covering issue, reminding them about this is a public health safety issue. Key times when to wear a mask, when to wear gloves, and we described all of this, gloves whenever they're sanitizing, when to hand wash. So some of you know that your hands are soiled, you hand wash. If you're seeing patients, between each patient. If you're taking off gloves, every time you take off gloves, you wash your hands. But also revisit those instances where if you just touch your nose or you sneezed, you gotta wash your hands. And if you haven't done any of those, because we're in a pandemic, we're recommending it at least every hour, hour and a half, or at least during your break, you hand wash for 20 seconds vigorously with soap. Don't take your skin off, but do it in a way that it gets the portion under your nails, etc. So we talked extensively about that. Don't forget that you also have the industries with specific guidance, whole list of specific industries with their own checklist. And these guides also encourage employers to post this checklist for employees to see where your efforts have been at in regards to COVID-19 prevention. So Cal/OSHA has sheets, like a single sheet for different types of industries. So use all of these resources for agricultural workers. Look at the tips: social distance when possible, wear a cloth face covering and gloves, wash hands often with soap and water, or use hand sanitizer, avoid sharing tools, disinfect tools. So just an example, right? When do we record? Whenever there's death, days away from work, restricted work or transfer to another job, medical treatment beyond first aid, loss of consciousness, and serious significant injury or illness diagnosed by a physician or other licensed healthcare professional. If work-related COVID-19 meets any of these criteria, then covered employers in California must record the case on their logs. You may not have ever heard of these logs that Cal/OSHA talks about, and this is your first time hearing about this COVID-19 in relation to the Cal/OSHA 300, 300A, and 301 logs. That may be because your place of employment is not required to keep them. So in California, there's an exception for certain types of businesses like retail. So some establishments do not have to keep these records, but some do. So find out. And the next one would be calling Cal/OSHA or reporting it. That's a different requirement. And that means whenever there's COVID-19 contracted at work, so where there is significant information that they contracted COVID at work, you must pick up the phone and call Cal/OSHA. Okay, guys, so there's the definition of serious injury or illness under Cal/OSHA rules that you can review. Did we fulfill our objectives? I think we went beyond just providing you with 3 work surfaces, 2 important updates. I gave you 9 that you have to make right now for that new document. I'll see you next week. I'm open to questions. It's great sharing this information with you. 12 o'clock, have a fantastic lunch, a great weekend, and stay safe.
Awesome. Thank you, Alba. Yeah, if you have any questions, stick around or you can message Alba. Certificates will be going out either later today or Monday, and we'll be sending the slides later today as well.
Thank you, guys. Thank you so very, very much. See you soon.
Awesome. Thank you, everyone. Have a great day.
Thank you, Lindsay. See you next weekend, next Friday.
Next Friday, yes.
All right. Bye.
Bye.